Hello, I'm Joan Meyer. The Bridges to Health Home and Community-Based Waiver Program, also known as B2H, is designed to support children in their homes and communities. B2H offers services not otherwise available in the community to children with complex medical conditions and does so in the context of their often complicated family and caregiver network. By supporting children in foster care or DJ Joy Community Services supervision in the least restrictive home or community setting, the B2H waiver program provides opportunities for improving the health and well-being of the children served and supporting permanency planning. In this video, we'll be exploring the details of the Bridges to Health program. The video features an introduction and 6 chapters. In this chapter, Chapter 2, we'll be reviewing how B2H benefits the child and family. As a reminder, B2H serves children diagnosed with serious emotional disturbance, developmental disabilities, and medically fragile conditions. Here to help us understand more about B2H and how it works is Kimberly Jefferson. Ms. Jefferson is currently employed with the Office of Children and Family Services as a program specialist in the Bureau of Waiver Management. She has more than 20 years' experience working in the social services field. Kim, thanks so much for joining us today.
Thank you.
The B2H program serves children in the least restrictive, most home-like setting possible, involving those in the caregiving network. This may include serving foster family, birth family, pre-adoptive, and/or adoptive family members. Now, Kim, what are some of the benefits to children of being in the most home-like setting possible?
Well, first of all, by being served in the least restrictive setting, the children are able to maintain all important ties in the community. Community-based services have a better chance of improving the health and well-being of children because, first of all, they're neighborhood-based, they're culturally specific, and they specialize, they're more sensitive to the needs of the children and family in the community. In addition, B2H supports the permanency goals of the FASB and reinforces the fact that children benefit better when they're in a home-like setting.
Now, I would imagine there are advantages for the children's families as well.
The children and families involved in foster care system are really inundated with a lot of different appointments for monitoring purposes or for different services. But with B2H, these service providers come into the home where the children are at. It reduces the inconvenience to the families. Also, because B2H services are designed to enhance and not duplicate or replace these services, it allows the families to have specialized services just designed for them.
Okay. Kim, can you give us an example of a healthcare integration agency and tell us what they do?
Sure. All of the healthcare integration agencies are voluntary foster care agencies that understand the complexities of the child welfare system as well as healthcare services. Healthcare integration agencies have developed specialized expertise around providing the 14 B2H services for the children and families. And the Healthcare Integration Agency provides the service of healthcare integration, and this service is provided by a healthcare integrator.
Okay. Who exactly is the healthcare integrator, and what is that person's role?
The healthcare integrator, is an individual that's employed by the Healthcare Integration Agency, and primary role is to meet with the family, meet with the caregivers, meet with the child, most importantly, to identify the strengths and needs of the family, and then meet with the waiver service provider in order for them to meet those needs.
Okay, you mentioned the waiver service provider. What is that?
The waiver service provider is the person that implements the waiver services such as skill building, planned respite, pre-vacation services.
Now, the structure that you're describing seems to sound familiar to something like a health maintenance organization or HMO.
Actually, they are similar. The B2H program can be compared to a health maintenance organization because as long as the provider is within that network, you can choose whatever service provider you want.
The freedom of choice component of the program allows children and medical consenters to make decisions regarding the well-being of their children. This fosters a sense of empowerment and builds self-esteem. Kim, can you explain this freedom of choice component for us?
Actually, the freedom of choice component is the paramount component for B2H. The child and the medical consenter can choose the healthcare integration agency that would best suit their needs. The medical consenter and the child can choose the healthcare integrator to coordinate the services. They can also choose the waiver services that they feel would be best suitable for the child, as well as who will provide those services.
Now, what if the family say wants to change providers?
Any B2H participant has the capacity to change any provider even after enrollment.
Now, in addition to avoiding hospitalization for these children, what are some of the positive outcomes that the B2H program hopes to achieve by offering these services?
Well, first of all, we want to stabilize placement in the least restrictive setting. We want to promote permanency. And we also want to strengthen and enhance the abilities of the caregivers so that they'll understand the child's mental health needs better, as well as assist the child in being successful in the community and in the home.
Kim, thanks so much for being with us. That brings us to the end of Chapter 2, Benefits to the Child and Family. In Chapter 3, we'll review benefits to the case planning agencies.